We will now move on to the next talk, which is again a very important aspect of obesity management, and that is cognitive behavioral modification in obesity management. And for this, we have Dr. Aaron Price with us, who's been a clinical social worker in the Behavioral Health Department at the Joslin Diabetes Center and lecturer at Harvard Medical School Department of Psychiatry since 2017. He's provided behavioral health care to patients living with diabetes and concurrent mental health and psychosocial concerns. In 2018, he has developed and implemented a type 1 diabetes support group and has been running this program for the past 3 years. Additionally, he has provided cognitive behavioral components of the Why Weight Diabetes and Weight Management program that you just heard about from Dr. Jacqueline and the Do It Diabetes Intensive Treatment Program. Prior to Jocelyn, he was a clinical social worker at Fenway Health, a community health center in Boston, and received his Master of Social Work degree from the University of Michigan School of Social Work in 2003. Dr. Aaron Price, I hand this over to you.
Thank you. Thank you. I'm Aaron Price. I'm a clinical social worker at the Joslin Diabetes Center. And I work with the Why Weight program with Jackie, who you just heard from about the exercise component. And so I provide individual counseling for people with diabetes at Joslin, but also the behavior modification components of the Why Weight program and the Do It program, which is an intensive diabetes management program at Joslin as well. So most of what I'm going to share with you today is from our experience with the Why Weight program. Providing some techniques and strategies you can use to help people make changes to the way that they think about food and exercise and to be able to sustain lifestyle changes for a long period of time. Ideally, what we want is for people to be able to create new lifestyle patterns that will last the rest of their lives, that they don't have to go back and start over from square one. So a lot of what we're going to talk about is geared toward that, helping people to incorporate new behaviors and lifestyles into their life so that they can manage their weight and their diabetes successfully for the rest of their lives. The goals of behavior modification are to ideally create conditions under which those lifestyle changes can happen. In order to do that, we want to help people to understand what their current patterns are. Why are they eating what they're eating, why are they eating the foods that they're eating, and how does that happen in the course of their day-to-day lives? Understanding exercise, why they exercise or why they don't exercise, and what kind of triggers there are for them to eat the way that they do. A lot of people that we see, and I'm sure that you've seen this in your practices as well, eat for reasons outside of hunger, emotional reasons, for instance. Stress, anxiety, depression, those sort of feelings can cause people to eat, and just to learn to use food as a coping strategy. So we want to help people to identify what their triggers are so that they can make changes to the way that they cope with emotions and stress and things that happen in their day-to-day lives. We also want to help people to establish clear goals so they have a sense of what they're trying to achieve and whether they're successful in achieving it, to create a sense of accountability. So we use a methodology called SMART goals, which I'm going to talk about in a minute, which helps people to establish very clear goals that they can follow through with. We also want to reduce shame and stigma. We know that here in the United States, and I'm guessing this is true in other countries as well, that there is still a lot of shame about being overweight, about having diabetes. So we want to make sure that all along the way that we reduce the shame and stigma that people experience. When people feel ashamed of themselves, they're more likely to continue the old unhealthy behaviors. So we don't want to use shame as a way of motivating people, because in fact, it tends to demotivate people and make it more difficult for them to make the changes that we're looking for them to make. We want to enhance coping skills. As I mentioned, food can become a primary coping skill, kind of a default, that when you feel a certain way or something is happening in your day or in your life, that you go to food as a way of handling that problem. So we want to create other coping skills, healthy coping skills that people can use instead of going immediately for food as a way of responding to life situations. And again, all of this is in the service of creating sustainable lifestyle changes. We in the Why Weight program is 13 weeks. I think Jackie explained a lot of that to you. 13 weeks, people meet once a week for those 13 weeks, but the program doesn't end in 13 weeks. Really, ideally, we want this program to be something that people incorporate into their lives and continue for the rest of their lives. So they never have to go back to square one and start over with weight and diabetes management. because they've returned to old unhealthy patterns. So I think a starting point when you think about the cognitive and emotional aspects of weight and diabetes, it's important to understand what drives you to do the things that you do. What factors are there that contribute to the way that you eat now? Because if you know where your starting point is and you know what you need to change, and you can make decisions based on that. A lot of times people, we all don't really necessarily think about why we eat what we eat when we do. We eat because we eat, and maybe we eat because it's a pattern, it's a habit, it's a routine, it's part of our culture, it's social. There's a whole lot of reasons why we eat that don't have to do with physical hunger. Some of those reasons have to do with timing, just the time of the day, the time of the week, the time of the season, holidays, things like that. So, for instance, some people would say, I get up in the morning, I stop to get coffee on my way to work, and when I get coffee, I get a donut. That's my routine. So I've been doing that for years. I go and get coffee, I get a donut, or I get a bagel, or I get some other kind of food that goes with the coffee. That's a routine. It's a time of the day habit that I do it every morning. A time of the week habit might be at the end of the week, I go out with my coworkers and have a beer and eat pizza, right? So every Friday night we go out and we eat pizza, and it's a routine. So when Friday comes along, I start thinking about pizza because every Friday we go out to have pizza. So by Friday at about 1 o'clock, I'm thinking about how we're going to go have a beer and pizza later in the day. So that becomes a time of the week trigger that to eat pizza. And sometimes it's hard to let go of that desire, even if you know that it's not in keeping with your goals and not in your best interest. Seasonal things could be having to do with certain foods that are available at certain times of the year. Holidays are very social and often involve food. You can probably think about holidays that you celebrate that have to do with always have to do with a lot in food, and maybe not just for one day. Here in the United States, for instance, there are holidays, especially the winter holidays, Christmas and Hanukkah, and that time of year. Food can be present for not just one day, but perhaps a whole month, from the beginning of December all the way through the beginning of January. So people can really have a significant setback based on holiday-related triggers. The most common type of triggers that we find, and this is what people often report to us, is that the cravings that they have are for certain types of food. So understanding what kind of foods trigger a craving in you. It could be sweet foods, sugar, cake, ice cream, cookies, things like that, or it could be salty foods, potato chips, pretzels, salty crackers, things like that. A lot of times people will go for one of those things or both. Unfortunately, people don't tend to crave things that are considered healthy, like lettuce or vegetables, carrots, things like that. We tend to crave salty and sweet. So if we understand that that's part of what drives us to eat is a craving for those particular foods, we can be more aware of that and conscious of when we're going to eat those. And what happens is that the craving can be introduced by a subtle stimulants. Like it could be somebody mentions going to get a donut or going to get pizza or things like that, and it gets into your head, and then you're thinking about it, and for the rest of the day you're kind of ruminating on that, and maybe you're trying to resist it, but by the end of the day your willpower kind of breaks down, and then you want to go get that food. So it's important to recognize what those triggers are so you can be conscious of that. There are situations that cause cravings, things that can be triggers for people. Watching TV is a big one. So if you can, here in the United States, and I imagine this is true other places as well, watching TV is also often associated with food. And it's usually sitting in front of the TV and eating in a kind of mindless way, possibly eating from a package, not really monitoring how much you're eating, and not really being conscious of what you're eating because you're watching the television program. Social gatherings often involve food, and they can be a lot of times the food is not necessarily healthy. When people get together, they may be having party food or things like that aren't necessarily healthy, but the food is very much part of the event. Breaks from work, some people where they work, they go into a break room, and if there's food available, it's usually not healthy food. There's pizza, there's cookies, there's somebody brought in, the leftover cake that they had last night, things like that. So there's all kinds of triggers in the workplace or just in the course of day-to-day life that happen around certain situations. And of course, maybe the most common one is feelings. And this is a really significant part of why people overeat or eat unhealthy foods and have difficulty changing it. And it's important to attend to this because if it gets ignored, it can kind of fly under the radar, and you wonder, why are they not changing, or why are they not changing the way that they eat? And part of it can be that they're very accustomed to using food to treat certain feelings, boredom, loneliness, stress, anger, anxiety. When I feel this way, it makes me want to eat a certain type of food. That's where those sweet and salty foods come in, because they tend to provide some immediate relief. So even though they don't necessarily solve the problem or make you feel better for long, they can provide some immediate relief. So people will often seek those foods when they're feeling a certain way: loneliness, stress, anger, those kind of things. So we want people to understand what feelings trigger that for them, so that they can be aware, if I'm stressed, it's likely I'm going to want to go get something sweet. And that way they can come up with an alternative plan to know, like, if I have that craving, I'm going to go try something else and do something different instead. So one way we do that is to do what's called a behavior chain analysis. And you can use this acronym ABC, the ABCs of behavior change, to look at the activating event, the behavior, and the consequence. So an activating event is any trigger that happens in the course of your life. It could be any event that happens. In this example, it's a meeting with the person's boss. So I meet with my boss and I'm stressed, and then I go to the store and I buy a chocolate bar to provide me some immediate relief. So the activating event is the stressful meeting. The behavior is going to the store, eating the chocolate bar. The consequence is the person may be off of their meal plan. They may end up gaining weight. They may not feel great physically, and they may feel guilty afterward. So there are consequences associated with the behavior. So what we want to do is intervene at the point of behavior. If we recognize that there's an activating event, we want to change the behavior so that we can affect the outcome. If we look at it and we say, okay, when you're stressed, what else can you do rather than go to the store and get a chocolate bar? What other things might help you to feel better? You have a stressful meeting with your boss. What other things can you do? One thing, for instance, might be go and talk to a coworker who understands, and maybe you can vent and talk with them about what happened with your boss. Or you could call your spouse or your partner, your husband, your wife, and ask and talk to them about it. Maybe you could, go out for a quick walk just to get some air and get out of that environment and get a little stress relief. Or at the end of the day, you could go to the gym and say, that's going to be the way I deal with it. When I get out of here, I'm going to go and go to the gym and get some exercise. There's a lot of different ways that you could handle that event without going for food. Some other strategies that can be used, and these are really important, because if you have trigger foods and you have them in the house, they're more likely to be eaten. A lot of people say they keep certain foods in the house because they want to have them there for their family members, maybe their children, their spouse, other people coming to visit. They want to have those foods around so that they can provide them for other people. What happens, though, is if they're in the house, they're likely to be eaten, because when that trigger strikes and you're feeling a certain way, you're feeling emotional in some way, those foods are there, so you're likely to seek them out. The other thing that can happen is that toward the end of the day, especially, people can work really hard at watching what they're eating, following their meal plan, exercising, all of that. And then at the end of the day, their willpower starts to wane. They start to get tired. And those unhealthy foods are there. They kind of call out to them, and they know that they're there. And even though they don't want to eat them, when things start to, they start to feel tired or stressed in the evening, when their strength or they feel a little more vulnerable, their willpower is down, they're more likely to go for them. So one way to approach that is to try to keep those unhealthy foods out of the house, or at least out of sight. If they're in the cabinet, they're in the freezer, not visible, it's going to help a little bit. You'll still know they're there, but maybe you won't notice them quite as much. It can also help to keep healthier food choices available, especially if they're good substitutes for the unhealthy food. I had one person in Y-Weight recently who every night he came home and ate a pint of ice cream. If a pint of ice cream is supposed to be 4 servings, at least on the container, that's what it says. So eating a pint of ice cream is, it's overeating. It's a lot of calories. It's a lot of carbs, a lot of fat, and all of that. So what he did was he started keeping lower calorie frozen yogurt bars in the freezer. And he didn't give up the routine, but he substituted the yogurt bars for the pint of ice cream. And he found that satisfying. And it was a lot easier on his blood sugar. It helped him to progress in his weight loss and that sort of thing. So you can have healthier choices around, especially if they're good substitutes for the things that you might be craving. It can also help to just change your scenery. So if you have a certain pattern, you come home, every day you come home when you get home from work, you eat potato chips and other snacks, you feel hungry, and you eat a bunch of snacks before you cook dinner at night. That's a pattern that some people told me about. Another common pattern is at night after dinner, that they'll personally eat dinner, and then around 8 or 9 o'clock, they start craving things, and then they go to the refrigerator and they look for something sweet or salty. If those are your patterns, it can help to change up the routine so that you're not in the same situation that contributes to the trigger. If your routine is to come home and sit on the couch and eat potato chips, if you come home and sit on the couch and try not to eat potato chips, it's going to be difficult because your brain is saying, your brain has associated sitting on the couch and potato chips. So if you try to just remove the potato chips and keep the sitting on the couch, it's more difficult. But if you change up the routine, you can find that you might be able to avoid that altogether. So that might mean not sitting down on the couch, maybe doing something else. You could just get started cooking dinner right away, eat dinner earlier, go out for a walk instead of sitting down, go and visit a friend, call somebody on the phone, any number of things, but changing up that routine in order to reduce the craving or the inclination toward that food. Another effective way to approach it is that when you have a craving is to distract yourself or delay it. If you think you really want something, give yourself about 20 minutes and ask if you still really need it. If you really want it after 20 minutes, you can always go back and get it. But if you wait a little bit, you might find that craving actually goes away or diminishes. And because sometimes those cravings hit and then you get yourself busy and occupied with other things, you can kind of forget about it. So we encourage people to try that. If craving strikes, give it a little bit of time. If you really want it, you can always go back and try to have a moderate portion, but don't necessarily go for it right away. So I mentioned goal setting. SMART goals is the methodology we use. It stands for specific, measurable, action-oriented, realistic, and time-limited. This is to help people set very specific goals. A lot of times the goals that providers give are well-intentioned, but not specific enough. So people often hear things like, you need to exercise more, or you need to eat healthy, but it's not clear exactly what those mean. So we want to take those kind of goals and make them and kind of fill them out, flesh them out a little bit. So, for example, to use the goal, exercise more. To make that a SMART goal, we might say, I want to exercise 3 times. I'm going to walk 3 times a week for 30 minutes in the morning before I go to work for the next month. Now, the reason that's a SMART goal, the S, it's specific. It specifies how long you're going to walk, where you're going to walk, when you're going to walk, and how many days a week. It's measurable because you can measure the amount of time that you walk and the number of days you walk. It's action oriented in that you're taking an action. Walking is taking an action. An example of a not action oriented, a goal that is not action oriented is one that is solely focused on outcomes. So that would be something like, I want to lower my A1C. Lower my A1C is a good outcome. Everybody wants to lower their A1C, but you can't flip a switch, push a button, do any one particular thing to lower your A1C. There's no action that directly relates to that. What you can do is increase your exercise, eat differently. So we want to set goals that are action oriented, that are about taking a specific action. Realistic, it's important that the goals are realistic because if a person sets the bar too high and they're not able to achieve the goal, they may become discouraged and then decide to give up and not try at all. So we want the goal to be challenging enough, but realistic enough that they can achieve it. And the time limited part is kind of setting a parameter on it. So it doesn't feel like you have to do this for the rest of your life. For instance, with the exercise goal, saying that you're going to do it for the next month, and then you're going to reevaluate, or you're going to do it for the next week. So I'm going to walk 3 times a week in the morning for 30 minutes for the next week, and then determine how that's going, evaluate it, and then you can always change that plan. If you need more exercise, you need less, but it's good to put a bit of a parameter on there, a time limit. Another way of increasing motivation and accountability is to track food and exercise. And Jackie referred to this. Jackie and our nutritionists at Joslin and the Y-Weight program review the data that people in Y-Weight collect about themselves. So we have everyone use an app to track their food and exercise. So they track everything that they eat and all the exercise that they're doing. And that allows the Y-Weight team to analyze what's happening in their day-to-day and to give them feedback on that. So not only does it provide the data, it also provides motivation and accountability. And accountability is really key for people to be able to sustain these changes over time. And it cannot only be accountability to other people, it also has to be a sense of accountability to self. And tracking food and exercise can help with that accountability, because if you are logging everything that you do, whether you do it on paper or you use an app, you are aware, you're very conscious of what you're eating. You're conscious of whether you're exercising or not. And a lot of people don't like to have to put into their log that they didn't exercise today. It doesn't feel good if you write, if you don't, you look at your log for the day and you see that you didn't exercise, or you see that you ate things that weren't on your meal plan. So it provides that accountability in that way. It's also important to recognize that when people are trying to make these changes, these are difficult changes to make. To be able to change the way that you eat and to add exercise to your life, these are fundamental parts of our existence as human beings. And these changes are not easy. They're difficult to make and difficult to sustain. But once people incorporate the new changes into their life, they become more natural. And one of the impediments to that is negative thinking. And I referred earlier to shame and stigma. And sometimes when that shame and stigma comes in, it can get in the way of people being able to maintain the changes and do the things that they need to do to take care of their health. One way that happens is when people are working at making changes to regard to diabetes and food and exercise, they can be very black and white or all or nothing. That is to say, if I don't exercise for 2 days or I eat things that are not on my meal plan, I've failed. And fall into a total success, total failure mindset. Either I'm doing it really well, or I'm doing it terribly and I've blown it, and it's not even worth continuing. And that will lead people to giving up. And then that once they give up, they end up getting out of those positive routines, those healthy routines, and then having to start back at square one. And that's one of the things we really want to prevent, is people falling back to square one. So it's important to recognize that it's not all good or bad. It's not total success or total failure. Making these changes is hard. You're going to have days when you don't do it perfectly, and that's okay. The important part is getting back on track and continuing to do the things that you know work for you. Should statements and moral judgments. This is when people say, I should do this, I should have done that, I should feel this way, I shouldn't feel that way. It has a sense of moral judgment to it, that what you're doing is wrong, or maybe even that you yourself are wrong, which again leads to discouragement, feeling disappointed, feeling that you're letting other people down, that sort of thing. And that all of that can lead you to giving up the healthy behaviors. Disqualifying the positive, the last one, is similar to that. It's focusing on one particular detail and ignoring the rest. So you'll see this a lot when people are trying to make these changes. They may be doing really well in a lot of ways, but they'll focus on one thing that they didn't do right, or that they made a mistake on, or that wasn't going well, and feel like they're failing for that reason. The other thing to be aware of is rationalization. And that is when you find a reason to do the thing that you know is not in your best interest. So that means to say, well, I've had a really good day. I've had a great week at work. I'm going to celebrate. I'm doing well with my diabetes plan. I'm going to go out and, eat pizza, or I'm going to celebrate with, cake and ice cream or whatever. Again, it's not so much that those foods are off limits, but that they may not be happening in a way that are moderate enough. So another type of rationalization is, I'm really stressed, and so I deserve to have that trigger food, whatever it is. It's one thing to decide in a conscious way that you want to eat that food, but you want to be aware of rationalizing doing something that you know is actually not in your best interest. Also, as I mentioned, a lot of people cite stress as a reason for eating unhealthy foods and overeating. So we, as part of the Y-Way program, we use stress management. We have a stress management session where we teach people stress reduction techniques like deep breathing and mindfulness. Deep breathing can be really helpful at taking the edge off of stress when people are really feeling overwhelmed or highly stressed. I've done it in my individual sessions and also in the group. And usually you can see a change come over people in just 1 or 2 minutes of taking deep breaths in, taking a deep breath in, holding, and letting it out. And just doing that, maybe 10 or 20 breaths over a minute or two, can provide some relief. And if people get used to it, they can do it for longer than that and get more benefits. A lot of times people feel relief when they do it in sessions, but then they don't continue it afterwards. Using an app can help with that. There are some good mindfulness apps out there that will guide you through the deep breathing practice and the mindfulness practice. And some of those are Headspace and Calm are the ones I hear people use the most. And those can help because, again, you don't have to do it on your own. You have a voice kind of guiding you through it. We also know that exercise is a great stress reduction technique. For some people, it's gentle exercise like yoga or Tai Chi. Other people get more stress relief from vigorous exercise like running, swimming, biking, those sort of things. It's also important to remind people to make a plan for when you feel stressed. What kind of pleasurable activities can you do? And it doesn't, especially that do not involve food. And they don't have to be things that cost a lot of money or anything like that. It could be sitting down and reading a book. It could be talking to a friend, taking a walk, watching a movie, something like that. But if you have it in your mind, sometimes when you're stressed, you can't think about what to do. You just go to your default. And if the default is food, you're going to go right for the kitchen. So I encourage people to make a list, write things down. What can I do when I'm feeling stressed? So that I can go look at that list and then pick something from that list before I go for food as a stress relief. Important to maintain realistic expectations. Perfectionism really increases stress, and have support in your life. So have some people to talk to about whatever's stressing you. I referred to mindfulness. This is one of we spend a whole session on mindfulness and why weight. We use a mindful eating practice, which involves taking a small piece of food. It could be something like a nut or a raisin or a piece of chocolate, even something like that, and just holding it in the mouth for about a minute and experiencing the full sensation of that piece of food in the mouth. It could be thinking about what is the texture, the temperature. Does the flavor change while it's in your mouth? Does the texture change? Really tuning into it and savoring that piece of food as much as you can. Because when we're eating on the go all the time, people are eating in their car, they're eating in front of the TV, they're eating while they're working, and don't generally take the time to really savor and pay attention to what they're eating. And eating mindfully means sitting down at a table, taking time to slowly eat and breathe between bites of food and to really savor the food. We want to teach people to do that. Food is a pleasurable thing. It's a good thing. We want people to enjoy food. And one way to do that is to really savor it. When you eat mindlessly, you don't really savor it. You don't even necessarily appreciate it. Sometimes you don't even remember what you ate. You just look down and the bag is empty and you didn't even realize that you ate it. So we want to avoid that mindless eating and teach people to eat in a more mindful way. One way quickly to do that too is to use a hunger scale. We use a 1 to 5. So to rate yourself, where am I on a 1 to 5 scale right now? 1 is I'm ravenous. I'm super hungry. I need to eat right now. Number 2 is I'm hungry. 3 is I'm comfortable. I'm sort of comfortably. I'm not hungry. I'm not full. 4 is I've just had a meal. I'm full. And 5 is I'm stuffed. So if you're at a 1 or 2, you want to eat. You want to eat a meal. If you're 3, maybe you need a snack, but maybe you don't need anything at all. Once you've had a meal, you don't want to eat past the point of being full of 4, because if you get to stuff, then you've overeaten. So this can kind of help people just to think a little bit about where am I right now and what do I need? As I mentioned before, we want to prevent people from becoming discouraged and going back to old behaviors. Lapses are normal in the course of any behavior change program. So if you're modifying your behavior, you can expect that you're going to have a lapse. That means you're going to have a slip. You're going to have a time when you're not following through on the plan. And that means that it might mean that you're not exercising for a couple of days, or you're not eating according to the meal plan. And that's a normal part of the change process. So we want people to really internalize that. This is a normal part of the change process. What's important is that when that happens, you get back on track by going back to the things that are working for you. So if you have a day or a few days when things aren't going according to plan, that you get right back on track and you start up again. When people feel discouraged, they get down on themselves, that's when they end up reverting back to the old behaviors. Once you've gone back to square one, we consider that a relapse, which is a prolonged return to unhealthy patterns. And if you've relapsed and you're back in the old unhealthy patterns, then you're kind of starting from square one again, and it's more difficult. So we want to intervene when there's a lapse and teach people to intervene for themselves so that they recognize this is normal. I'm disappointed that this happened, but I need to pick myself up and start again. One way to do that is to create a relapse prevention plan. So to know what are the signs that you're starting to slip? Okay, for some people, it might mean I've been starting to eat certain foods again. I'm eating salty, I'm eating sweet. For some people, it might mean I haven't exercised in 3 days, 4 days, however long. And if that happens, that's when I know I need to do something to get myself back on track. And then you go back to the things that you know were working for you. In the Why Weight program, we have a structured plan that they follow. And so if people know they're slipping, they can go back to that structure plan and start to do those things that were working for them again. Because ultimately our goal is to help people maintain these changes for life, as I mentioned before. We don't want people to think about this effort to manage diabetes and to change the way that they eat and add exercise to their lives as a diet. Diets are temporary, right? And most of the people that we see have been through diets repeatedly. They've done a diet, they've made some progress, they slip back, they gain the weight back, they do it again, and it's a revolving door. This is just a quick table on the difference between a diet and lifestyle. As you know, diets are quick. They tend to be radical. They're all about good foods or bad foods, eating this, not eating that. It's something that often causes you to feel deprived or angry or want to rebel against yourself or whoever you feel is imposing this on you. A lifestyle, by contrast, is long-term and sustainable. It's about moderation. There are not good foods and bad foods. All foods are foods. And you can have, there's no food that is off limits, but it has to be done consciously and in moderation. And we want to encourage people to be flexible with their food choices and ultimately to change the attitudes about food, that we can think about food differently and that create these new patterns that are going to sustain us for the rest of our lives. So thank you very much. I look forward to any questions you have. I'll be with you for the panel discussion in a little bit.
Thank you so much. And we will want you to be at the panel discussion after the next talk. Thank you so very much for that nice talk.